Hi everyone. I hope this is working again. We just test drove it a few minutes ago with my guest today. It's Dr. Hirmand from New York. As most of you know, I'm a plastic surgeon here in practice in the city. And I specialize in eyelid and facial rejuvenation and regenerative technologies and aesthetics. And with our Med Spa Skin Lab RX, we are actively involved in new technologies. So welcome to the global beauty space. Sorry, my second time on Instagram Live, so bear with me. I'm going to invite our speaker in. The global beauty space came about because I realized that I am so lucky to know some of the world's most fantastic experts in our field. And it seems like we all want to be connected now to each other all around the world. And I'm trying to, I guess, contribute in my own little way by bringing you these experts who I call friends. And I'm looking for Dr. Tiryaki to invite him in. So let's see. Okay, I'm going to do this and invite him and add. This works. Believe it or not, we practice this, so thanks for your patience. Hopefully he'll accept. So first and foremost, I just want to wish everyone a great day and a healthy day. Hopefully you and your loved ones are healthy and staying safe wherever you are in the world. And Dr. Tiryaki, if you're hearing me, I've sent you a request, so please accept so you can join us. I'm going to say a few words about Tunç Tiryaki, my good friend. He is the director of Cellest plastic surgery in Istanbul. He is also the owner and operator and surgeon at TiryakiSurgery in London. So he's in between London and Istanbul. He's Turkish. He's widely published author of articles and book chapters, his latest book chapters. On stem cells. He's an educator. We've taught at many meetings together. And there we go. Let's see. Go live. There we go. I think we got this. Connecting. Fantastic. Oh, wow. Okay. Well, there you go. It worked finally. I'm just introducing you. He's an innovator. I've mentioned most of it. So hopefully you were hearing and
yeah, I was trying to jump in.
I know. I like the books behind you. It's true that that Tunç is also very scientific about everything he does in life, including his professional endeavors. He's the section editor of our International Aesthetic Surgery Journal. So thank you for that. So Tunç, I've said a lot of stuff sort of awkwardly waiting for us to join. But listen, how are you doing? You're in Istanbul now or in London?
I'm in Istanbul. Yeah, the weird days, weird times. My family is in London, my son and my wife. But I got stuck in Istanbul. Actually, it was very funny. The night before I was supposed to fly to London, they closed the airspace.
Oh, wow.
But it's okay. I mean, they are doing fine there because they are together. And we are trying to do the things we were not able to do before.
So you FaceTime with them every day?
We FaceTime, we talk every 2 hours. Yeah. And at the same time, I'm able to do some work at least.
Okay. And they closed the airspace in Istanbul. Is that what you were saying? They closed it the day where you were flying.
The Turkish airspace is closed.
Okay. So we don't hear a lot, at least here in the United States, about what's happening in Turkey. We hear about some other countries, China, South Korea, Germany, but Istanbul, Turkey, we don't hear much about. How are things there? Everything is on a lockdown. Are the numbers going up? Are you, where are you on the curve? Anything you want to share with us? That would be great.
I don't think there's too much difference in between countries. It's very similar to London. Like what we are going through is exactly the same what we were going through in London. And I think it's the same in New York. In Turkey, the things are a bit different. Like in the week time, we are not locked down, but we are supposed to stay at home. Okay. And weekends, it is not a lockdown, it's a shutdown. So
Okay, so it's just
Kind of like
completely
we are
shut down.
more on both extremes. Yeah, like week time I can go to job, I can go to to the clinic, but
Okay.
weekends it is a full lockdown, so I cannot go even out.
Okay, how are the hospitals? And I'm going to get to that because that was one of my questions. If I look over, I have my questions here for you. But how are the hospitals in Istanbul dealing? Are they at capacity? Are they doing okay because they closed down and social distance quickly? What is your impression? I know you were in the hospital and you do go here and there for several things. You know, share that.
Yeah, I think we are doing okay. The system is catching up. The doctors, they are working like crazy, as anywhere, as in New York, as in UK. But yeah, I think the system is not overloaded, I can say that. So I think the government is doing okay. The system is catching up. The people are getting more and more conscious. I think it's a process of learning the new way of life.
Yeah.
And education.
Yeah.
So I think, these like lockdowns, shutdowns, so people are getting used to this new reality.
Yeah, and it is a new reality for sure. And what's the reality for your practices? I mean, I know you have actually 2 locations, a very vibrant, active practice in London, the UK, and your obviously fantastic, expansive practice in Istanbul. So how have you managed? They're both closed, completely closed. Are you doing any procedures? What's going on with that?
Yeah, of course. I mean, that's a problem. Normally, before this, I was practicing 1 week in London and the other week in Istanbul. So I was just flying every week. But now, of course, I cannot do that. In both places, the clinics are shut down. So we closed down the clinic in Istanbul on the 16th of March. Since then, we are not doing literally anything. But it seems that from the beginning of May, I think we will start seeing patients doing some minimally invasive. I presume that we can start doing operations under sedation and local anesthesia in June.
Yeah.
Depending on the situation, depending on the Ministry of Health's regulations, we might even start doing general anesthesia operations in July. That is not a promise, but I think we will get open starting with May.
In May, slowly. Yeah. I mean, I guess safety is really the key. And was this a mandated closure for you guys for non-elective, or was it voluntary closure?
It was not a mandate, but everybody on their senses.
Yeah.
I mean, we literally closed the clinics. We don't see patients for the time.
So what are you hearing from your patients, both in Turkey and in the UK? How are they not necessarily, I'm talking vis-a-vis beauty. I mean, is there do you feel like there's cooped up, like, oh my God, I've got to like get in to get my Botox or my surgery? Or what are you in touch with your patients and how are they responding? I mean,
I think humankind is dealing with this in a very proper way.
Yeah.
People are really very much aware. And I'm saying this not only for our own patients. I see it on the street, on every level of the society.
Yeah.
I mean, people are very much sensible. So they are asking us when we can go back to start working. But nobody is forcing us to do anything.
Yeah. Yeah.
So they are waiting for us, and we are waiting for the information from the Ministry of Health to come. That's what it's for the UK as well. The clinic in the UK, they are also expecting that guidance of the NHS. But again, like, people are very much sensible. And like, from another perspective, like, I was trying to figure out how this would affect our businesses. And there's a very interesting information about the Second World War. In the Second World War, the only industry which didn't get smaller, guess what? It was cosmetics. And these, like, the lady socks.
Yeah.
It just thrives.
Yeah.
So basically, these kinds of crises doesn't affect the sense of self-importance and self-care.
Yeah, it's interesting because I remember even in Afghanistan after the war, the first thing that opened were the cosmetic, not surgery clinics, but makeup and hair. It's very, very intriguing. That's another whole long conversation to have. Honestly, it's actually intriguing. I have to echo the same sentiments. Our patients have been so sensible and so understanding, and you know, we've been working with them from the beginning to keep them safe and just to communicate and say, look, you know, our first job is, my first job to my patients or responsibilities to keep them safe. And if I'm not, you know, I'm seeing all this happening and we need to prepare, there's no room for elective stuff, but there is a way to sensibly reintegrate into life to this new reality, as you say, slowly. And they've been so understanding. They've, you know, kept in touch. They call, we reschedule, we explain. It's like a week by week phenomena here. So, and now for now, I think we're looking at mid-May and earliest June still. And for surgeries and bigger procedures, you know, we really have to come up with the protocols, with the testing, with the diagnostic testing, antibody testing, figure out how are we going to do if it's anesthesia, if it's not. So that's another whole thing. But what I want to talk about, because now that I have you, and I'm so lucky and fortunate, I'm really thrilled that you're doing this with me. So thank you for everyone. Really, it's a resource that I'm so excited to share with everyone who's on this live. So I spoke to you, I called to check in on you. I think it was about a month ago or 3 weeks ago, to see how you were doing and how your family was doing. And I found that you had spent the whole day in the ICU, in the COVID ICU, gowned up and protected to do a procedure. And I have to say, I was blown away. I was like, wow, you must be kidding me. I mean, the most I did was like do telemedicine, COVID, you know, for my patients and my friends, you know, free of charge, just to help our ER docs. And I was just so impressed. So it turns out, of course, you were harvesting stem cells and, you know, whatever. So I wanted to talk about that. But since it's stem cells, I wanted first to ask you, can you tell us all, what are stem cells? Where do we get them from? Where, I know you're passionate and we share this passion about regenerative aesthetics and medicine. So what are they? Just basic, quick tutorial 101 on stem cells. Where do you get them from? And then tell us about, you know, and then I'll ask you a little bit more about your ICU and how you were dealing with this COVID situation, how you were contributing or involving or participating with it.
Yeah. Okay, let's start with thanking you. I think this is an amazing idea, and I'd love to be with you anywhere, and this is amazing. Thank you very much for hosting me. Going to the stem cells, let's start with what they are, yeah? So, like, imagine you cut your arm, and the body heals itself. In a very simplified way, your stem cells are the cells which are healing you. We have these stem cells all throughout body. So you have them in your brain, you have them in your skin, you have them in your fat, and you have them in your bone marrow. And they are your reserve cells in order to tackle with problems, with wound, with injury and everything. And basically they are the cells which make us. Like basically the first stem cell of yours is the first cell of your embryo. So they are the stem cells. And why they are called stem cells? Because any cell can stem from them. So if you take them from somewhere and inject them to your skin, they will become and reinforce skin cells.
So they can become any cell.
Yes, and that's why they are called stem cells.
That's exactly
so they can...
right. And you explained that so well. No wonder. I couldn't explain it that well.
Yeah, well, I was thinking about it for the whole night. I'll tell you.
You were preparing.
I was preparing.
Yeah.
No, yeah, basically they can turn into liver cells, into your eye cells, into your skin cells and everything. Now, when you talk about stem cells, people are thinking about bone marrow, usually. To simplify the things, you have majorly two types of stem cells in your body. You have the stem cells in your bone marrow, which is recreating your blood cells. So if you have any problem with your blood cells, leukemia, lymphoma and such stuff, then you have to harvest and utilize your stem cells from your bone marrow. And they are called hematopoietic, bloodline stem cells. And that's not my job, because I'm not doing that thing. The second group of stem cells are called tissue stem cells, mesenchymal stem cells, and they are usually residing in your fat. And they can be harvested and they can be used for tissue, meaning your skin, your fat, your bones, your cartilage. So the stem cells which are important for you and me, they are mesenchymal fat-derived stem cells.
More for me, because I see myself all the time now on FaceTime and Zoom, and I really do need it. So, okay, we'll get to that. We'll definitely get to that.
You absolutely don't need that. But I mean, everybody will need it basically sometime, yeah? So these are the cells we plastic surgeons are interested. Right. And what we can do with that is I can just make a small hole in your thigh and get a little bit of fat, which you don't want to have anyway. And that literally takes 10 minutes. And from that fat, I can isolate the stem cells out. I can harvest your stem cells. And we know like fat has 500 times more stem cells in comparison to bone marrow.
Right, and now, this is what people don't know, actually, which I think is really fantastically important. And I'm sorry, I don't mean to interrupt you, but that adipose tissue, that fat, is such a rich reservoir of stem cells for us.
Yeah.
And it's easily harvested. It's not a complicated procedure. You don't have to go into the bone. It's a really easy kind of get out, hand lipo type procedure. But anyway, so I just thought that's really important to highlight.
No, you are totally right. There are 3 reasons why you are using fat-derived stem cells. First of all, it is easy to harvest. You can get it anywhere from any part of your body. Second, they are the ones you want to use. If you want to improve your cartilages, let's say you are having knee problems, you can get your fat, isolate stem cells injected into your knee. You can inject them into your skin in order to reverse the aging process. You can inject them into the fat tissue. You can inject them onto the bones of the face in order to reverse the main problem of facial aging.
Right. And please, Tunç, promise me that you're going to come back more than once, because this is such a huge topic between the mechanism, the science, the regulation around the different countries. I mean, there's this conversation that's going to take hours, and I just want to make sure I touch on the really, really cool stuff. So please come back to do that.
Anytime.
So tell, I would love to hear from you what you were doing in the ICU, harvesting fat from, what were you doing it for? What study was it for? You don't need to, if it's too detailed, but just again, first of all, thank you for doing that, and you're still healthy, so I'm assuming all the precautions you took worked, and they appreciated you doing it, and you're a collaborator on the study. We don't have a study here in New York with stem cells, because I did look into it. I know that you said in San Diego, they're trying to set it up. In the US, we don't have an IRB study yet for stem cells for COVID-19 that I know of. But tell us a tiny bit before we get to aesthetics, because I want to make sure that we use your time properly. I want to get to the aesthetic, because that's the fun part. Is what were you doing? What is this study in a nutshell, and how were you contributing?
Yeah, okay, that's a very important question, because there are myths and people are expecting miracles. Miracles do not happen in science. We know in COVID, the reason why we are losing the patients is a process called cytokine storm. So it is not the virus which is killing the people, it is the overreaction of your immune system. So the immune system panics and starts like telling to the body that we have to do this, we have to do that, etc. This is the cytokine storm. And that is killing the body itself. It's a suicide, sort of. We know stem cells have immunomodulatory effect, meaning it can calm down your immune system in the right way, in the right level. So mesenchymal cultured stem cells are used in order to deal with immune problems or immune like diseases. And in COVID, we have some data from China and other countries that they use it very successfully. Now, the problem with cultured stem cells is they are limited. So there's a limited source. And for example, the patients we did the injections with autologous fat, were the patients who couldn't have the mesenchymal stem cells. So it was a Saturday, and there was not enough mesenchymal stem cells in the hospital. So either we had to wait them die, or we had to just do something immediately. And what we did was we went into the ICU. In the ICU, on the bedside, we did a small lipoharvesting, like 200 cc's of fat. That literally takes us, again, 10 minutes, while the patient was intubated anyway. So we harvested the stem cells, and we re-injected them intratracheally into the lungs.
Oh, wow. Yes, and you told me this, and again, it amazes me. When you harvested the fat, you processed it to get the stem cells right there and then in the ICU?
Yes, exactly. That's what we did.
Okay, and you did the mechanical isolation? How did you isolate the stem
cells? In one, we did a mechanical isolation, and in the other one, we did both. We started up with a mechanical isolation, which is reducing the time for enzymatic digestion. So we did a combined or hybrid approach.
Did you use your LipoCube? And I'm going to interject and tell everyone here that, as I said, Tunç is a major innovator, and in full disclosure, I have test-driven your LipoCube, which I love. He's a co-founder of a new device to isolate fat, microfat and nanofat being the rich stem cell component. And hopefully it's going to get FDA approved for us here. Well, the microfat also has fat, obviously stem cells, but we use it in aesthetics. Hopefully we'll get to that, but hopefully it'll get FDA approved here at some point soon. Again, we're going to get to that, and you'll tell us a little bit about that. And you're also the chair of the humanitarian projects that are international ISAPS, International Society. So this all ties into everything. Everything is tying into each other. But going back to your activities in the ICU, you were using, were you using your new device? Were you using the LipoCube, or were you centrifuging?
Yeah, we used LipoCube, yeah.
You did use the LipoCube.
It is like this now. LipoCube, or let's say mechanical systems for fat, have two different steps. In one, you can resize the fat. That's not what we used.
Okay.
In the other one, which is called the SVF process, you mash down the fat, and then you take the stem cells out. Literally, it's not nanofat. It is a very condensed, concentrated suspension of stromal vascular fraction.
You extract it out, basically.
Yes, and then that was through the bronchoscope that was injected into both lungs.
So tell us just quickly about the study. It has two arms. It has intravenous and intratracheal arms, meaning putting it down the tube to help the airway, and also systemic. It has two different arms. And is this approved by the equivalent of the IRB that we have, Institutional Review Board for Human Experimentation? Is it approved by the Ministry of Health, or what? How does it work over there?
It's different now. We call this approach like IV SVF, but that must be enzymatically digested.
And say again what SVF is for everyone. Stromal vascular fraction. Can you just tell everyone, because maybe some people don't know what that is?
Yes, it is what we can just simplify it in a way like a fat-derived stem cells soup.
Soup, yeah? In a matrix.
In a matrix, yeah. So, you know, Aris, our good friend Aris Terodimas, he calls this approach as a sandwich approach, because we have the problem at the lungs. You inject the stem cells through the veins, and they go through to the lungs from outside. And we inject the stem cells from the fat through the trachea, which go to the lungs from inside. So you treat the lungs from outside and from inside at the same time.
Okay, so it's a combined study.
Yeah, for Turkey, we applied. Now, this was an emergent situation. So we had special invitation and approval. But now we are applying for a normal Turkish IRB. Okay. Where we're going to have like permission to try on 20 patients. And I think Aris and his group, they got an American IRB as well this week. Wow. It's just very recent, yeah.
Oh, wow. Oh, that would be amazing. And do you know where that's going to be? Is it a multi-center IRB? Where is it going to be instituted?
Good question. I don't know. No
Okay.
answer.
Well, I'll find out. I know because you told me, well, why don't you go to the ICU and take some fat and give them stem cells? And I said, oh, sure. I'm calling Presbyterian right away. There was no IRB.
And they are just waiting for your call, right?
Yes, there is no IRB. They're literally just so frazzled. They're just trying to keep people alive.
I think now there is.
They're trying to keep people alive. There are some studies between Columbia and Cornell here, but there are no stem cell studies yet. But okay, so let's this for me. This is fun, but you know I'm also really geeky and nerdy and all of that. But I want to hear from you. The really fun part is, again, what we are both passionate about is regenerative plastic surgery, regenerative aesthetics. How do you use, what's your favorite way to use stem cells in rejuvenation in your practice, down and dirty, practical for people who are watching from all over the world? Like, what do they ask for? How can they use stem cells to feel and look better? And what's the news?
Okay, that's a topic for 2 hours, but I know.
Okay, we'll extend it a little bit, and then we'll go to part 2. So just give us the teasers, and then I'll get the questions from everyone based on your teaser, and then we'll come
Netflix
back.
serial. All right, very simplified way. First of all, we have to define what we are fighting against. Aging, let's say face. The face is aging because we are losing the structural support of the bones. So my chin and my cheekbones, they melt, and my skin just sags down. The skin sagging is a secondary issue. So we have layer by layer problems. We have bone loss, we have fat tissue loss, and we have skin quality degradation. Now, if I can get these stem cells out of patients' fat, which literally takes 10 minutes, and another like 20-25 minutes, I can harvest the stem cells. I can inject them onto the bone, to the cheekbones, to the chin, which is going to necessarily create a kind of like a sharper jawline and sharper cheekbone. I can inject the same cells to the fat tissue, and the SVF, the soup, the stem cell soup, can be injected into the skin. So I can do actually a layer by layer treatment, like touching all these different layers affected by aging, the bone, the soft tissue, the skin. And in this way, we can, in like literally 40 minutes, do a lot of rejuvenation.
Right. So, but to be clear again, for those who are not practitioners and are not familiar, to break this down, when you say you take the stem cells and you inject it in layers, give us an idea, because stem cells in and of themselves, they may not be volumetric, so they're not going to recreate potentially. So give us an idea of how are you using, is it for the volume aspect or on the bone? Are you using microfat? Are you using more fat, mature fat cells with stem cells in them for that? You know, so I know we all do it a little bit differently. So I just want to find out from you, how are you using the stem cells on these different levels? And where you need volume, of course you have stem cells, but then you must also have some cells that are fat cells. So give us your view on that. So just to clarify, so that it's more tangible.
Well, it is like this. Now, you take the fats and you have 3 different structures to reinforce the face. You have strong fats on the bone. Right. And you have to have a bit softer fat for the soft tissue, and you have to have stem cells for the skin. So what we do, I mix meaning
again, stem cell rich, because the thick fat also has stem cells in it, right?
Very little.
Meaning per volume little. Meaning it's not concentrated, but there's still stem cells in there.
Yes, exactly. So
sorry, I don't mean to, you know that I've always wanted to be a journalist. So.
Oh, you're doing great.
This is my chance to clarify so nobody gets confused.
You know, you're doing great. Absolutely. Yes, like you're totally right. Like for the bone only, we are doing macrofats and stem cells together. Right. For the fat tissue, for the soft tissue, we are using microfats. And stem cells. Right. And for the skin itself, we are using only the SVF, the soup.
And when you say for the skin, again, and I like a sandwich procedure, but tell us for the skin, are you going right under the skin, or are you putting it on the skin and needling it in, or are you doing both with that nano fat, which is the really thin stem cells, rich portion?
Okay, now nanofat is not the stem cell rich thing. Now, what we do inject with thick cannulas on the bone, thinner cannulas into the fat, into the soft tissue, tiny needles into the skin, intradermally.
Okay.
And then we are using a technique which was designed by Steve Cohen, the kind of like tapping,
okay,
intraepidermally. So we do an into the skin and over the skin superficial injections, all of them together at the same time. Now, touching base on the difference between nanofat and the SVF. Nanofat is, let's say you have 10 cells in 1 gram of fat, 10 stem cells. Yeah, if you inject 1 cc of nanofat, you inject 10 cells, right? But if I harvest 100 cc's, 100 grams of fat, concentrate all the stem cells into 1 cc, in that 1 cc of SVF, I have, instead of 10 cells, 100 times 10
concentrated
cells. 1,000, yes. So SVF is a extremely concentrated version of nanofat.
Yeah, exactly. And that's kind of what I meant, but just to simplify it so that, again, not confusion. But thanks for clarifying. So you're using these channeling and putting it over through the skin.
Yeah.
Are you also injecting it subdermally underneath the skin, right underneath the skin? Does it take to do this type of a procedure for a person? How long does it take to do a full face, multiple levels, different levels of fat, for volume, for you?
It's actually a very fast procedure. Like harvesting of the fat takes around 10 minutes. Stem cell isolation takes around 25 minutes. But at that time, I already start injecting the deep fat.
Okay.
So altogether, for me, a facial stem cell injection would take less than an hour.
Okay. And do you use anesthesia? Is the person under sedation or Pronox or local, or what kind of anesthesia?
Yeah, you can do it under local anesthesia because you're going to take the fat from a very local environment, and then you can do just blocks for the nerves, or you can do the local anesthetic for the face, and you can literally do it without any problem, like as if you go to a dentist. But if I go to the dentist, I would prefer to have sedation.
Okay.
So for my patients, I think it is much nicer to do it under sedation, because sedation is literally, I just give you a sleeping drip. While you are sleeping, I do my local and I do my injection. So it doesn't change the duration of the operation, but it is much more comfortable, I would say.
Okay. I have a question for you from one of our viewers. How can you keep control of symmetry lying down? Good question.
I don't. First of all, everybody is asymmetrical, and asymmetry is one of the things which gets the attention of the eye. So it is a part of attractivity. If you are perfectly symmetrical, you are not attractive. And we are like normally asymmetrical, but at the end of the surgery, you can just look and see. And that is the arrogant answer to this is actually what we do is an art. So taking the same fat, injecting to the same face, you can create a miracle, whereas another one can create a chimpanzee. It's like
okay, you're as always making me laugh. But I think you're right. I think there is a little bit of an art to this, and you have to kind of rely on the experience of the person who is doing it. That's why we choose, certain people over others. But I do agree with you. I think there is this misconception that we have to be 100% symmetric. As I'm looking at myself, for example, right now, I'm completely asymmetric. I mean, I never looked at myself so much, but I mean, like literally, I'm so asymmetric. And I always say gross asymmetry is not attractive, but micro asymmetry is actually attractive, because the brain views it subconsciously as attractive. And there's some studies, you know, they took some top supermodels and they actually digitally made them exactly symmetric, and none of them were as attractive as they normally are with their asymmetry. So I think we're all, you know, we have a small side of the face, big side of the face. I mean, we're all asymmetric, and everybody's so focused on symmetry. But of course, the truth is also you don't want to wake up and have one side like this and one side like this. So to your point, there's part artistry, part experience. And when is the next flight to Istanbul? I'm coming over.
You have to. You have to. We have good food here. But, you know, like there's one more thing to add. People are very much afraid of asymmetrical results, even if I finish the operation in a fully symmetrical way. That, like, that's the question. You're like, what happens,
right,
or what if one side of the fat is resorbed and the other side doesn't?
Was my next question.
That does not happen, because first of all, the vascular circulation is equal on both sides, and the skin pressure on the top of the fat graft is equal. So there is no such a thing that an asymmetrical absorption of the fat would ever happen. It never happened in 5,000 patients.
Okay, that's actually good information to know. Tell me a little bit about recovery. So let's say our patients get this procedure and they get customized based on their needs, the different types of stem cell included or stem cell enriched fat, whatever way we call it, SVF, nano, macro, micro. So now what is, and I know depending on what kind of fat they get, probably there's a little bit, and what compartments we're in, there's a little bit different in swelling and all that, but overall on average, and I have a comment. Dr. Tunç is very charismatic. What's his secret? So keep that quick question for the next question. Nobody ever, by the way, nobody ever told me that I was charismatic and what's my secret. I'm just
because you are beautiful.
I'm just saying, okay?
Yeah, you don't need to be charismatic. You are beautiful.
That's my last question to you. What's your secret? But that was a good question, whoever asked it. So we're going to save that question for you. But going back to recovery, so what do they expect, practically speaking? How much time do they take off from work in a place like New York or Istanbul or London? I mean, people don't have a lot of time. What do they do to plan?
Okay, it depends on what kind of treatment we do. Basically, if we do a fat grafting, and I would say there is no difference in terms of healing period between normal fat grafting and stem cell injection to the face. They would be the same. Now, it literally takes, as I said, 40 minutes. You come in the morning, midday, you go home. After 48 hours, you can just wash your face, wash your hair, put your makeup, and literally actually go to job or Zoom with somebody. You would be
48 hours. Did everyone hear that? 48 hours, really? That's great.
But 1 second. You are not normal. Yeah, like you are still swollen. Yeah. What I tell to the patients, this is the rule basically. In a week time, you will be still freaked out. Yeah. First week, even though you will not be very bad, it's like you will be swollen. In the second week, usually the patients are saying, wow, that's nice. And on the third week, they say, you should have put a little bit more. So this is kind of like how it goes.
Okay. Yeah? Do you plan for a one stage procedure, or do you feel you need, especially with the SVF stem cell areas more superficially for the skin component, do you need more than one treatment, and how do you plan that for the patients, again, for practical planning?
Yeah. Now, for example, if the patient is limited in time, or if they are younger, if they do not need a lot of revolumization, then we do it slightly different. It is called SVF Gel, and the name belongs to, again, Aris and his lovely wife. So there, what we do, we combine fillers with a superficial stem cell injection only. So what we do, we revolumize with fillers, and we inject the stem cells only in order to improve the skin quality. There, you don't have any downtime.
Okay, so one option is do one time of this comprehensive fat stem cell SVF, and then do going forward sessions with fillers and just the superficial channeling from the surface of the SVF, correct, of the stem cells. How far out from the first procedure do you usually do this second skin procedure?
Okay, that's a good question. Now, if I would be doing a full-fledged fat grafting or stem cell injection, I would say I wouldn't do it again for another 5 years. Yeah.
Even for the skin component. No,
that's different. Then, yeah, for the skin, you wouldn't if you do the only skin and combine it with live filler, because there we mix the filler with SVF. So the longevity of the filler is a bit longer, more sustainable. But then probably you would need to do it in 2 years' time. But if you do a normal full-fledged stem cell injection, that's 5 years. Now, what are the limitations? Again, then, of course, that's the next question. It is very much dependent on your skin laxity. If you don't have too much skin excess, fat grafting or stem cells would work perfectly. If you have a little bit of it, then you can combine it with, you know, those like micro lifts, etc. And if it's like too much, then you have to combine it with a facelift.
Right. Tunç, we have so many questions you can't even imagine. I mean, there's so many questions. I've written some of them down. I've seen some of them, and a lot of them are actually coming from doctors, surgeons, and practitioners. So I feel like we have to have double session. Like we have to do one session of something just for that. Or I'm sure, I know you're doing some of that. But also, let me just ask you, because we've gone over a lot, I wanted to ask you, and also, hello, Stephen Cohen. Stephen Cohen joined us at some point, said hello. So my good friend, our good friend, Steve Cohen, who is brilliant, is also on here.
And charismatic.
Yeah, thank you for joining. I hope you're well out in San Diego. So last thing, complications, downsides, patients, people listening. Number one, what should they here in America, of course, we have informed consents. We write on it, things that, you know, could happen. What are the things that you tell patients can happen with this procedure that they should know about? And also, who is not a good candidate for this without tightening? You know, it's like, who is not, like, is there someone who's going to walk in there's two questions. Who's going to walk in your door that you say, you know what, nah, I'm not going to do, and I'm talking about the full procedure, not just the skin one.
Yeah, if you do this, and if you have just 1 centimeter skin excess, only fat grafting or stem cell injection would be enough. If you have 2 centimeters or more, then you have to do something with the skin.
What do you think about me?
You don't have anything.
I do. Like, am I a candidate or no? Come on, be honest.
No, your skin is great, so you don't need anything to the skin for sure. So that was the first question. What was the second?
I'm still coming to Istanbul on the next flight to get fat grafting. That's all I'm saying. As soon as this is done.
No, I mean, fat grafting is maybe the most important tool in our toolbox. I cannot imagine any facial surgery without an added fat grafting, I would say.
Yeah, it feels like to me we've gone through sort of this up and down. You know, we had fat grafting, the old, you know, your grandmother's fat grafting. And then we saw, anyway, I did a lot of distorted faces, overfilled. Really, you couldn't even recognize the person. And so everybody, including our patients, really shied away from it. And including me, there was a time where I was like, no. I was always very conservative, really chose the person very carefully because I saw so many overdone, really crazy results. And now we've come full circle to really a new technology with fat grafting where we are so much more knowledgeable about the power of what we're dealing with. And this tool, which is let us not only recreate contours and revolumize, but also regenerate and really reboot the skin and the tissues ability to regenerate. I mean, I find it fascinating, and we can really use it more intelligently. I mean, I don't know if you agree with that or not.
No, I agree. We have to make one thing clear. Now, yes, we are seeing all these like terrible results, bloated faces. And the reason of that is very simple. You don't need to have that. The problem there is you have two problems. You have volume loss, and skin laxity.
Mm-hmm.
Now, if you want to solve both problems with one single shot, yeah, with just volumization, and that's the problem which is created by dermatologists and medical aestheticians.
Don't slam our dermatologist friends.
Look, I'm not saying that all of them are like that, but come on. It is like this. If you... Haideh.
No, I honestly think, okay, I know you're saying...
No, what I'm saying is very simple.
It could be anyone who just misdiagnoses and does it wrong, not just one specialty, but honestly, you're right. It's really choosing the person, the correct procedure for the person, right?
It is very simple. If you have skin laxity, and if you want to address that with fillers or fat grafting, you have to bloat the face.
That's exactly right.
So simple. If you have skin laxity, you have to address that separately.
Yeah.
And then there is no problem.
That's why you're so good. You're an artist, but also really smart, right? And you're going to teach us everything about stem cells and save the world. You know, so we've gone, this has been so amazing, beyond my imagination. It's gone overboard. Is there anything that I mean, I have so many, honestly, still questions about use of reconstruction, or reconstructive uses of stem cells in plastic surgery. I have so many other questions, but you know, it's already 15 minutes after what I imagined, like the attention span of everyone. I mean, but I've like really loved talking. I learn every time I talk to you. It's amazing. Is there anything that you want to highlight that I may have not asked before we kind of defer for this, for this segment?
Yeah, there's one that I just read. One of my very good friends, Hakan, he's one of the best plastic surgeons in Turkey, and he's doing a lot of cleft lip surgeries. He asked, I just catched it up, whether we can use these stem cells for pediatric patients, for the children. Absolutely. Absolutely. Of course, we can. You
can. And it has been done. I just saw a comment that said this was so informative. So I just wanted to thank you. I really, it's just, I'm so thrilled that I caught you live. I am actually looking at you. I
thank you. That was amazing.
Honestly, I missed so much. The days, I know our meeting was canceled. It was supposed to be now in Las Vegas, and I look forward every time to going to our meetings. Really, a lot of it has to do with the fact that I get to hang out with my friends and colleagues like you, and you specifically, to laugh, eat well, talk about science, talk about ethics, talk about philosophy. You've told me so many things over time about life, and I learn something all the time from just hanging out with my colleagues, and I'm so fortunate to know some amazing leaders in this field, and the comment that this was informative was just so dear to me, because that's
making us happy.
It just
that's
made me
all what
really,
we want.
Thank you. Yeah, it made me really happy, and it also made me just thank you again for taking this time. I know you must be amazingly busy. It's Friday night there. You've had probably a long week in and out of the ICU. Who knows what you're up to there. The only thing I say is that I miss Turkish food. I love Turkish food.
Yeah. Once you open the airspace, you have to come in.
oh yeah. Trust me, I love Turkey. Nothing will keep me away from Turkey. So what are your plans? Are you planning to stay a little bit there, or as soon as, because you also have to attend to your work and your family in London. So are you looking to go back and forth at some point? Just give us a little personal glimpse into your reality there.
Yeah, I mean, as long as they open the airspace and they cancel the this, like, you know, when you come back to Turkey, you have to stay for like 14 days in the in quarantine, etc. Once they are over, and I hope it will be over end of May, I will of course fly back to London, hopefully.
Yeah, so maybe we get to talk to you from London next time. Who knows?
Or I will invite you. Now I learned how to join.
Now you know how to use Instagram Live.
Yeah.
Please promise me, because there's so much we didn't get to talk. I know you wanted to talk about exosomes and about extending lifespan and all this stuff. And and I'm so into that. And I have actually have a new program that we're going to institute in our med spa. So I want to run that by you and talk to you about it. I'm so excited about it. Nobody knows. I actually, my manager is going to kill me because I kind of let the thing out of the bag now, but it's going to include all of that stuff. So please promise me you're going to come back.
I will, and let's close it like a Netflix serial. Now, what else? You know, there is immortality business. There are exosomes, which are how the stem cells work. Let's talk about them.
Yes, I look forward to it. I'm reading so much now, more than ever, because I have time to read. So it's been amazing. And again, I'd love to ask you more questions about that and also answer your questions about that. So we're going to keep the conversation going. I had a comment to tell you. Someone from New York said Dr. Tunç Tiryaki should also be invited to come visit us in New York. So we'd love to have you here when we open, and we'll hang out in the practice and see patients together and just have fun. So, you know, we have to think about the good times when we can socially undistance.
Hopefully. Haideh, thank you very much.
Thank you so much.
So wonderful.
This was great. Be safe, and everybody, please stay healthy. Please stay safe and send me your questions, and we'll do this again soon. Be safe.
Take care.
Take care. Bye-bye.